Hello, everyone. Thank you so much for tuning in and joining us for this amazing webinar. Thank you so much to the amazing Mary J. Blige. That is her song, Doubt. And how many of us know what it feels like to make it to the end? Even as you start in a new chapter, in a new season, we have made it. And that is what we are here to honor, to recognize, acknowledge, and be empowered by today. I am Alexia Dumboya. I am the president of CocoLife.Black, and so proud to be able to share this space for this very important webinar, #Engage for Moms, our community engagement strategies to address maternal health, particularly the impact of IPV or intimate partner violence and DV or domestic violence in maternal mental health. Want to thank you all so much for joining us. Just a couple housekeeping rules. If you are not speaking, I know we've been zooming it out for a long time now, so you probably already know these, but just bear with us. And just keep yourself muted and off screen. If you are not speaking, we will have opportunity to do Q&A, because we want to hear your voices. In the meantime, though, if you could, you should be able to drop in the chat where you are from, your name and where you are from, and what way that you represent in this space. We have so many talents among us, and so it's just beautiful to be able to share this space together. So please feel free to do that. Your chat should be available to have that access to do. If not, with that, I want to hand it over as well. Thank you so much. The chat is enabled. I would like to hand it over now. I see Arkansas in there. Hi from Jacksonville, Florida. Hey, Kenya. Greetings, Demetria from Georgia. Thank you so much again. Nashville, Philadelphia, just beautiful. Keep dropping those in, because guess what? This is how we build community. The only way that we will see these improved outcomes is by working together. So thank you so much for showing up in this space. With that, I am going to hand it over to Reverend Dr. Q English, who is the director of the Partnership Center, just to continue our conversation and talk a little bit about our area of focus. Thank you.
Thank you, Alexia. Again, I'm Reverend Dr. Q English. I'm the director for the Center for Faith-Based and Neighborhood Partnerships at the United States Department of Health and Human Services. I'm so glad to be with you today. At the center, we have 5 focus areas. I'm going to go through them real quickly. One, obviously, is maternal health. Secondly is suicide prevention. Third, substance use disorder, inclusive of overdose prevention. Fourth is youth mental health. And last but not least is our ongoing efforts around encouraging boosters and vaccinations. And with that in mind, we are encouraging all that are on this call, if you haven't, to please get your updated vaccine this fall and winter to protect yourself and your families. We have seen COVID-19 infections increase in prior winters, but it does not have to be that way this year. So visit vaccines.gov to find a location near you with flu and updated COVID prevention vaccines. So again, welcome to the first webinar on maternal mental health. And as we look at the effects of intimate partner violence, as well as domestic violence on maternal mental health, This series came out of the feedback to create regular engagement opportunities for partners during our maternal mental health event we hosted earlier this year with the American Psychological Association. Another bit of housekeeping, we are asking that if you do have questions, we will have an opportunity for Q&A, so please take a moment to drop those questions in the chat as you're listening to our presenters. Turning it back now to Alexia.
Thank you so much. And we are so fortunate today just to have this time again. So I'm just going to briefly go through the agenda, and then I want to do a little icebreaker with you all. So our agenda today includes some amazing speakers who are going to share their lived and learned experience, particularly in this space. We'll do their introductions a little bit later. as we go through this process, but we'll have those conversations, those topics from professionals, again, who will give more insight into this space. We will do a activity towards the end that will allow us to do some sharing as to other ways that we can support this hashtag Engage for Moms. And I'm also going to ask that as you post about the experiences that you've had and the work you do, please use that hashtag Engage for Moms. We'll drop it in the chat so you know exactly how to format it. But let's do a quick icebreaker before I hand it back to Reverend Dr. Q. So if you could, we're showing up in this space coming from different things. We may have just, depending on where you are, you could have just finished breakfast or lunch or ready for dinner, depending on where you are joining us from. But how about this? Drop in the chat a song that represents how you feel right now. I'm not going to ask you to sing it. Don't worry, you don't have the mic in and sing it. But just so we can continue building community, drop in the chat a song that represents how you feel right now. So if I was going to drop in the chat and then you'll see the lover. Oh, I see Overcomer. Come on. Yes. Golden by Jill Scott. Happy. That's one of my favorites. I think the one by Pharrell. The one I'm feeling right now is Blessed. So there's a song by Maverick City and it's called Bless Me. Good Morning Gorgeous. I see Rise Up. That's how I'm feeling right now. I Am Blessed, Mercy Me, Greater. Please keep dropping those because guess what? How we show up in this space and how transparent we are with each other is another way that we continue to be able to build community. Thank you for that. And I see that level up. With that, I'm going to level it back up and hand it back over to Reverend Dr. Q. Thank you.
Now that was fun. Thank you, Alexia. I think I'll go with Pharrell and Happy. Thank you for that. So I'm excited about introducing our first speaker here today. She's the executive director for the White House Centers for Faith-Based and Neighborhood Partnerships. I welcome Melissa Rogers.
Thank you so much, Reverend Dr. Q, and thank you, Alexia, and hello to everyone. It's so great to be with you. I loved Alexia's icebreaker. I think my song is Joy Invincible by Switchfoot. Thank you to everyone for this wonderful gathering, for your dedication to these important issues. I am very honored and pleased to bring you greetings from our President, Joe Biden, and his thanks for the important work that you are doing each and every day to help others in your community. You know, Joe Biden understands that for us to change lives and to help people across the country and around the world, it certainly can't be government working alone. It has to be government working with wonderful people like you who are so dedicated to helping your community to thrive, being there when people really need help and may not know where to turn. So we're just thrilled that we are able to run these partnership centers that partner with you. Our mission is serving people in need, and the means that we reach that mission is to work with you to do that. And that is a special, special opportunity in government, and we're grateful for it every day, and so grateful for this time with you. As Reverend Dr. Q said, there are agency centers for faith-based and neighborhood partnerships spread across many federal agencies. And we try to work as a team to break down silos and to really address problems that people are facing and to make sure that people can access federal resources. And that we hear back from you where things that are federal resources that we're trying to provide aren't meeting the mark quite right. So this is definitely a two-way partnership, a two-way conversation, and we're just glad to be able to have it with you. We know that when we come together on important issues like the one we're talking about today, our collective efforts are much more than the sum of their parts. And so I just want to say again how excited I am about the community that's being built here. So many talented and enthusiastic and selfless people. And I'm so pleased that we have Reverend Dr. Q English at the helm at the HHS Center. She's such a brilliant leader, and I know she will help shepherd this effort along with Alexia and others of you. So thank you again. We look forward to working with you to help others live more abundant lives And we're just so grateful for the time that we have together. So with that, I'll turn it over to Reverend Dr. Q again or Alexia, you may be the next one. So I'll turn it back to you, and thank you for your amazing leadership and for your stewardship of your time and talent toward this important cause. Thank you.
Thank you. Thank you so much, Melissa. What an amazing opportunity, right? To be visited by not only just you in person, but being able to see the efforts being recognized at all different levels of leadership within our government. I think that's one of the things I'm so excited about as I get ready to introduce our first speaker right now, is that we aren't operating in silos or working alone. We do have a government that is interested in supporting this movement right now. And that's why it's so important that we share this space and speak. So thank you so much again, Melissa. So first up with us today, we have Dr. Vanessa Abernathy. She is the owner of Phoenix Rising Psychological Services and an assistant professor at the University of Southern California, specifically in their Department of Psychiatry. And so I will turn it over to her so she can keep us and bless us even more with her work.
Great morning to each of you. Wanted to just honor everyone here in the that's in the space, either on the platform or in the listening audience, and those who will catch this on the replay. I do want to just start by saying it's important that we get an idea of who these women are. These are women who are in heterosexual relationships, same-sex relationships, that are women of faith, women who may have been abused by faith communities, and are trying to reclaim some of those faith claims and communities for their healing journey. And I also want to make sure that we understand that the effects of intimate partner violence and the impact on maternal health can also have negative outcomes for the neonatal experience for the infants, including low birth weight and preterm birth. But these are things that are multifaceted, and the biggest piece, and which is why we're here, is that these are largely preventable effects. And so that is the hope that we come with this discussion. So I want to share just a few things with you of what the mental health effects might be. So one, it might show up in the woman's behavior. She may have insufficient or inconsistent prenatal care. We know that a great place to kind of check in with these women are in their healthcare visits. But if they are not accessing those, and they say in research says 3 or more absences from their prenatal care visits, then that may be a red flag. And so we have to be creative in our ways to check in, and not only check in at the beginning of their pregnancy, but throughout their pregnancy, because some research shows that the increase in violence may happen over time. And for some women, it is an actual pause in the violence that has already been taken care of. They may have poor nutrition. They may have inadequate weight gain. So these are things that you can see on the outside looking in. There may be some substance use and misuse, maladaptive ways of coping, things that you would not expect a woman who is carrying a baby to engage in, but in her survival mode, this may be her way of coping. There may be increase in depression, anxiety. So depression is the common cold of the mind, and I always say anxiety is its annoying cousin. But that really low, or that excessive worry that can be exhausting and create hormonal imbalances in the body, which can also lead to poor health for the mother and for the baby. Also, some of the risky health-taking behaviors. I mentioned some risky sexual behavior. Sometimes these women are assaulted sexually in their relationships, or they may engage in unprotected sex, which could lead to sexually transmitted diseases, or also unplanned pregnancies because of the nature of their relationship. So not only might they show or present with depression and anxiety symptoms, they may present with clear post-traumatic stress symptoms. And when those are co-occurring with depression, then that can just exacerbate even pre-existing health conditions like hypertension or diabetes. These women may also experience thoughts of death by suicide, and sometimes in the greatest way, maternal homicide is also a part of what happens when these things are not addressed. So that's the hope that I bring to this conversation. So we may see some isolation. So usually when women are carrying a baby, there's a lot of celebrations, there are gatherings, even if they're just minor shopping and preparation and nesting activities. But when you see a woman who is off to herself, who's not engaging with other people, and they're not coming out, and they're very reluctant to have people come in, that may be a sign to look at. Also related to poor nutrition, we talked about that, and sometimes a loss of appetite because they may be so depressed or so anxious that those have been disrupted. Sleep disturbance, they may have trouble falling asleep, staying asleep. And also when we talk about different pregnancy complications that can also happen from these mental health concerns that are on top of their physical needs. And so when we think about ways that we're going to talk about later, ways that we as community leaders, and especially people of faith, might support these women, one of the things that they might present with is low self-esteem. They're usually not women who started out with low self-esteem, but over the course of the relationship, because usually the bondage starts in the mind, right? Where they are experiencing coercive controlling behaviors, expressive aggression, calling names, putting down, throwing objects, finding ways to really intimidate the woman early on, even before the physical violence ensues. So this type of violence could be verbal, emotional, spiritual, psychological, and even financial. So we don't want to just limit it to what we see, because a lot of times the scars are invisible. And then when it talks about women's inability to trust, that's where our community and our faith community can really start to make differences with that. So that's another area of hope. And also fear of intimacy. Those two will both tie into their relationship with the faith community. They may have flashbacks. They may be replaying the instances of abuse and aggression and assault in their minds. They may have chronic headaches, other chronic pain that aren't typical in the course of pregnancy. They may have limited activities beyond those that may be expected for a woman carrying a baby, because a lot of times society still thinks that if you're pregnant, you have some mysterious illness and everything, you have to be careful. I remember when I had my two, and I would come and people would give me these wives' tales, and I'd be so worried. And my OB here in California, he'd say, "Who told you that?" Shout out to Dr. Conwell Carter. But these are just some of the things that you might see, the impact on the women themselves, and then on the babies. We talked about, I mentioned low birth weight, preterm birth, being born before they're fully developed. Sometimes gestational diabetes, or being born young for their gestational age, or being small, for their gestational age. And then at its worst, neonatal death. So those are just some of the things that I look forward to the conversation later about how the faith communities can interact and impact and offset these effects, because I tend to work in both ways. I was trained theologically and psychologically. So this conversation is really near and dear to my heart. And with that, I relinquish the mic.
I think what you were about to say is, I will drop the mic, and I appreciate the way you showed up in this space, Dr. Abernathy. Thank you so much for bringing so much awareness for us to this space and educating us. One of the best ways that we can show up as a community is to educate, engage, and be empowered. And through that education, we can be empowered to engage more. So we thank you so much for that. Just another housekeeping practice I wanted to give, just because of the amount of people we have on, it'll help us to more quickly and easily get to your questions. You can drop them in the chat, but what we would encourage you to do is use the Q&A function That's in Zoom. So if your screen isn't widened up, you can click on the three dots or where it says more, click on Q&A, and you should be able to drop any of your questions there. You can even do so anonymously if you would like. And so please feel free to utilize that function. And when we get to that space of the Q&A, we can go right to some of those questions there. So thanks again to Dr. Abernathy. You'll be able to find out more about the work that she does and again, read her full bio when we share that information in our recap. Next up, our speaker for today, we have Doreen Lassane, CEO of Sunshine in My Living Room. And I don't know about you, but just thinking about the day and the nights and the things that we navigate, having sunshine in my living room brought me such a warm feeling. So with that, thank you so much, Doreen.
Okay, thank you, Alexia. Wolf. So good day, everyone, from wherever you at. Thank you. Thank you for making the time to be with us. And also thank you to the partnership for the opportunity to participate in this very important discussion. Um, Dr. Abernathy provided us with such a comprehensive overview of domestic violence and intimate partner violence. And thank you so much for that. And I'm just going to kind of segue into that and add a little bit onto it by sharing just a few statistics, right? And statistics show that there are over 20,000 domestic violence related calls a day nationally. 20,000 domestic violence related calls a day nationally across the 50 states. Just let that sink in. And within that, every 10 seconds, a woman is abused or battered by her intimate partner. According to the National Institutes of Health, intimate partner violence affects as many as 300,000 pregnant women every year in the United States from every age group, every religion, every ethnicity, socioeconomic level, and educational background. And many women report that the abuse tend to start or intensified when they became pregnant. So when I think of maternal mental health and IPV, I see it from a dual sense, a dual set of lenses. As a professional working with victims and survivors, or however they choose to identify, the professional tone of interacting with this population for me isn't often used because of the immediate emotional crisis that is presented in that moment. And because most of my contact with victims and survivors is with them prior to them making contact with service providers, I choose to take more of a compassionate versus the professional clinical approach. I mean, quite honestly, there is nothing professional or clinical about intimate partner violence. I'm used to saying domestic violence, so excuse me, because those terminologies are like interchangeably. So intimate partner violence. And so domestic violence and intimate partner violence in and of itself is a very frightening and confusing experience. And to add to it, a pregnant mom who has been physically assaulted or a brand new mom who has been tossed around a room or verbally abused in the public while holding a small child doesn't quite know how to respond to what has happened or is happening to her. The health and the well being in every area of that mom and child has definitely been compromised. And it's really difficult for them to understand what has just happened and why. What did I do? What should I have not done? Right? And it is because of those moments that I choose to scrap the professional lingo and choose not to be clinical, but to be empathetic, kind, choosing my words and the tones of my words very carefully. And really, I've also learned that listening more than speaking really helps the victim in that moment. So imagine someone saying to you as a victim of IPV or domestic violence, I'm concerned about your maternal or even mental health. In that moment, that person, that victim, have no clue what you're talking about because most of them don't, and they can't even process what you're saying because of what has happened or is happening to them. And just as people typically do not self identify as victims of domestic violence, victims usually do not understand the concept of maternal mental health, how that maternal mental health is being impacted by the violence that is being perpetrated against them, or that they and their unborn or newborn child is even being exposed to the outside violence. So let me take this time now to offer my second set of lenses to offer you a different perspective. As I said briefly at the beginning, there is nothing professional or clinical about domestic violence. So before you is a professional with a graduate degree in criminal justice, 3 New York State certifications. I'm a published author. I'm a professional with over 25 plus years as an educator in various modalities. Psychologically, physically, and emotionally, I'm safe and I'm in a safe space. However, that has not always been the case. I've lived through intimate partner violence. I've been tossed against walls. I've been tossed around. I've been physically assaulted. I've been verbally denigrated. I've been emotionally demolished. I've been forcibly held against my will. And I've been raped through 2 pregnancies. I was psychologically battered, emotionally drained, and spiritually dead, and not at all in a safe space. And the abuse did not stop just because I gave birth. And this is what the vast majorities of mothers, mothers to be, and new mothers face when they are being abused. The faces and the names may be different. However, the details of the abuse, the trauma endured, it remains mostly the same. But by the grace of God, I did survive. I survived the long nights and extremely long waiting times alone and unsupported by emergency department staff. I survived judgment by medical professionals and even within the walls of my then house of worship, where my son was tormented by the other children. Your father beats your mother. I survived victim blaming by psychotherapists and social workers who were professionals and very, very clinical in their approach. So, this is not to slight anyone in these professionals. Um, it is just to say that sometimes when people don't understand the complicated and complex nuances of domestic violence, they don't understand the presentation of the person before them. Dr. Abernathy was fabulous in the way she described how sometimes people personality appears to change, how people start to present themselves. And a lot of times victims do come across as being confrontational and unrational, but that is their way of surviving that moment that they're in. And that goes to their mental state that is being totally obliterated by the abuse that they're suffering. And I also survived the silence by everyone who saw the screams and heard the screams, saw the bruises, and they saw my belly. But let me rephrase that. We survived. By the grace of God, we survived. Those 2 children of mine survived physically. And even though I was being abused during those times, I did. I went to all of my prenatal appointments. I took care of myself as best and as well as expected. But what I didn't know and what I was never told was how the external factors of that abuse were impacting me and my then unborn children. And like many women, I had no clue. And many today still don't in this age of information overload and easy to access information. In reading abstracts from studies, it is my opinion, as one who has personally experienced and endured intimate partner violence in all of its insidious forms, prenatal and postnatal, I believe that in researching the impact of intimate partner violence and maternal mental health and even maternal health, just doing 2 months postpartum studies is not enough to accurately gauge its long term effects. My children were impacted beyond their newborn status of 2 months. And to this day, they still have health concerns both mentally and medically as adults. My mental health and my physical health was impacted well beyond the typical 6 weeks postpartum and well and above 2 months. Actually, it lasts well into 15 years after the abuse. And many of the findings are accurate. And yes, clinical interventions are needed to assist and support battered pregnant women throughout pregnancy to minimize serious physical and emotional problems. To gain better understanding of the maternal health and the impact of IPV, more must be done to educate first and foremost the medical field, especially those who are in pregnancy clinics and the emergency department. There must also be more done within programs that cater to girls to educate them about reproductive health and intimate partner violence before they become statistics. There's an old adage: an ounce of prevention is worth a pound of cure. And with respect to intimate partner violence and domestic violence, intervening and most intervention strategies are not working. Managing crises after moms and moms to be are victimized does not diminish the numbers of victims of intimate partner violence. More must be done with respect to prevention of both intimate partner violence and its impact on maternal health. To anyone who is viewing this and may be a victim of domestic violence or intimate partner violence, I see you. And in your silence, I hear you because I was you. And what we are doing today is for you. Don't apologize for who you are in this moment. Just continue to do the best that you can until you can do better. And I end by saying this: houses of worship and houses of faith also have a responsibility to address this very complex and complicated issue of intimate partner violence, domestic violence, and maternal health, as many of their congregants, parishioners, and members are currently in the fight of their lives, both pregnant and not. Thank you.
Thank you, thank you, thank you so much, Doreen, for your bravery, for your transparency. And one of the things that we often do, and I apologize, I did not offer this up when we first started, but myself and one of the other mom ambassadors that I work with, Anika, who is a social worker, what we like to do is when we open up in this way, we invite you also to drop in the chat something that can affirm or can show support as we have these conversations. So just as we get ready to move into this space, please feel free to affirm Doreen. You can say, I see you, I support you, I am you. And these are the different ways that we show how we build community in this space, just like how she said, I hear you, I see you, I support you, I am you. So let's just continue to show up for each other in those spaces. So let's do this. We are going to move into our question and answer portion of it. I know you may not have had a chance to drop questions because you were listening so intently to what was being shared so far, but please know you still have time to do that. And we're going to start off with, just as we wait for some of the other questions to come in, I did see that, or I was going to ask if Dr. Abernathy, one of the things that came up was about the neonatal consequences. And so if you could just dive a little deeper into what that conversation is, and helping us to understand those challenges on maternal health. Like some of this, we probably have people joining with all different levels of understanding, right? And so you helped us get a nice baseline, but if you could just dive a little deeper into those neonatal consequences. And as you're talking about that too, if there's any additional baseline knowledge that you can share with us, particularly around maternal health, I think, and some of those challenges, feel free to include those as well.
So thank you. I want to honor Doreen and all who will speak out, because what we experience in this, I share in my ebook that I'm a 4th generation survivor of domestic abuse, misuse, and the type that I experienced was more psychological, emotional, spiritual, financial. And I want you to imagine putting a newborn in a hostile environment. Would you ever consider a newborn being in the middle of domestic terrorism? And that's exactly what happens. It's a place where the woman should feel safe and cared for. This is her human right. This is a social problem. It's a social disorder, really, that our community is plagued with. And so when you think about the infant is tied to the mother, and there are certain hormone levels that help the mother stay at peace, at rest, calm, so that things are functioning in a way that creates a safe environment for the infant from conception all the way through, even to if they enter into a nursing, breastfeeding relationship. So part of it is the hormones like cortisol that naturally occurs in our body when we need to, take action, fight or flight. When you're in a chronically abusive relationship or hostile environment, those cortisol levels don't always regulate. So you need them when you need to jump and save someone or to run or to fight. But if you're constantly in a state of fight, flight, even when you're not initiating it, you may not know what type of partner you're coming home to, which is why it's really important for our faith communities to start to heal the hurts that even the perpetrators experience, because those who hate themselves hurt their families. And so when you think about those cortisol levels, they cause an excessive amount of those hormones in the bloodstream of the baby, in the mother, and then that affects the baby. And then when the mother is drinking, you might have fetal alcohol syndrome, where the baby may be born with certain body parts and functions within their body that don't develop fully, which could affect their behavior later. They may have facial features that you may recognize that there's something different about this child, which could also affect their ability to learn and to grow, and even to socialize and regulate their own emotions. Babies can be born with anxiety because of the intense anxiety that the mother has experienced. So all of the chemicals in the brain of the mother are released into the bloodstream that also impact the baby. So low birth weight makes it hard for a baby to thrive. They may not even be able to eat when they're born. They may have complications that can go throughout their life. Some of the things that we think are typical childhood illnesses could come from being in a hostile prenatal environment. So those are just some of the ways that can impact a baby.
Thank you again for that. And I think a lot of what came up that I think about too is the conversation around prevention, and especially with our young people, and helping them to become aware. Education is so valuable in this space, because there is a lot of this medical term. There is a medical term that addresses the whole flipping of the lid, if you will. And so when we don't have an opportunity as young people to understand what happens with our bodies, and then you go on to engage in some of these relationships that don't serve you well from a mental or physical health, as Doreen was sharing too, that compromises everything, including this new life that is being birthed. So I will jump into a couple of the questions that have come up in our Q&A section. And one of them is, what have you seen? And this could go to Dr. Abernathy as well as Doreen, depending. Please feel free to give your input. But what have you seen enhance women's ability to be self-sufficient after experiencing IPV and or some kind of relational trauma, which could be DV or beyond, side of that? So again, the question is, and we can start with Doreen if you would like, but what have you seen enhance women's ability to help be self-sufficient after experiencing some of this type of relational trauma?
I think one of the greatest things is support, right? So when you have somebody just, we always hear people say, well, why don't you leave, right? Which I always say is the number one wrong question. But now when you move beyond that and the person have left, escaped, or whatever the case is, and they're no longer in that situation, they need support, right? The statistics also say that a woman leaves 7 to 10 times before they actually leave, right? So what they're doing is that they're testing the water, right? And part of testing the water is that when I leave, when I start feeling kind of jittery, or maybe I'm going back, a lot of people need a support system to help them remain out of the situation. And that support system has to come with being non-judgmental and with understanding that sometimes that person may still talk about the person that harmed them, right? That's typical of part of their process of now disconnecting from that relationship. So for me, the person has to have a support system when they are in that situation, a support system when they have been removed from that situation, a support system as they now, in a sense of speaking, learn to live again, right? Because Dr. Abernathy spoke, briefly about the financial piece, right? So someone who's been in an abusive relationship where the other person control all the finances, if I'm no longer in it and I don't understand banking, I don't understand balancing a checkbook, I don't understand budgeting because I didn't have the access to do all of that. I need a support system. I need somebody who's going to be gentle with me and somebody who's going to understand where I'm at and where I need to be, and they're going to guide me along that process. So the support is crucial.
Support is crucial. Thank you so much for that. Dr. Abernathy, anything you wanted to add to what would be helpful?
Sure. So there are a couple of things. One of the things that I tell women is to resign from the cover up. A lot of times they've been covering up, what has happened. And I know for me, my faith claims were weaponized against me because I had a certain value related to covenant, right? And covering people in prayer, but it became covering up what was happening. Especially, it's important before the physical violence escalates and starts. So resigning from the cover up means talking to someone. It seems unspeakable, but once you speak it, right? When you think, it breaks the lie that you're the only one. When you think you're the only one, it means that there's something wrong with you. But once you know you're not the only one, you can decide there's nothing wrong with me in this situation. There's something wrong with this situation and what's being done to me. So even the faith claims about sin. So I'm very much in touch with my sinful nature. I know that it's there. So when this is happening, I'm examining myself, but where is the space for the sins that are committed against me? And so having conversations around that with safe people who are going to hold things in confidence. And I think that's one of the things that the clinical community, we're trained to hold things in confidence, right? It's our ethical mandate. But a lot of times in our faith communities and our other supportive partnerships, we don't hold that. And if you can put that before a woman, it creates a safety net that is unimaginable. They can open up in ways that they never even thought possible. But when they know that you're bound by a code that says, I'm going to hold this in confidence unless you're at risk, then they may share. The other is to arm yourself with education. You have to educate yourself on what happened and how could this happen? Because most women are surprised, like, I can't even believe that happened to me, right, in this day and age. And so one of the things that I teach is that there's this law of intermittent reinforcement. We see it in Vegas, right? We pull the slot, we get a little change. So we know that we've hit before. So it's not unrealistic for us to keep expecting that to happen again. Well, in these relationships, there's a cycle of power and dominance and abuse. So you may start out with this very whirlwind courtship, very intense dating in the beginning, almost like being swept off of your feet, what you see in Disney, but in real life, it's a setup to victimize you. And so once you see that, you know that you met that person. They didn't say on the second date, well, sometimes the abuse happens very early, especially when the women are young, but you get this person who is like, I'm going to say Prince Charming. And you met that person, but then the violence or the humiliation or the betrayal, whatever it is, happens. And then you go back and forth. So your brain knows if there's something in the behavioral way that our brain is designed to know that if I hit it before, I can get it again. Maybe they're just having a bad day. Maybe they're just dealing with the things that I know that they experience. And then the other thing is to understand that there's centers in the brain. There's a pain center, and then there's a pleasure center. So that part of you where you first met them, you felt attached to them, you both felt pleasure, but you felt attached to them and pleasure, but they didn't attach to you. That it could be that part of their brain never opened up those chemicals that made them feel bound to you. And so where you're still bound to them and you're experiencing this abuse, the pain centers haven't registered that this isn't pleasurable anymore. And so I want to say that to normalize why we don't leave, right? There's so many competing forces within and around us that make us want to kind of stick it out and not say anything. And then how people respond makes a difference, because when people shame you, when you ask, well, what did you do? That's the wrong question. The question isn't even how you're showing up now. It's what happened to you, and to listen to her story, however she needs to tell it.
And I would like to add really quickly that when you talk about those pieces where the survivor stays and some of them want to stay, there's also those barriers that prevent them from leaving when they want to leave. The number one is fear, right? And when we tell people not to be afraid, you cannot tell a person what not to be afraid of when what they are enduring behind their closed door, they're enduring it and you're not, right? So that comment that people make, oh, but if I were you, if you were me, you'd be doing the same exact thing that I'm doing, right? And so fear is one of those barriers that prevent people from leaving. Their religion, their faith prevents them from leaving, being spiritually abused through sacred writings and scripture in the Bible, right? Having children, right? Even, people talk about, oh, well, you could just go to the shelter system. It is not that easy to pick up with 4 children and go into a shelter system, because here in New York, everything is done by procedure. In other words, and also by family size. So if a mom has 4 kids and she's trying to go to a shelter and they don't have enough beds for the 4 kids, that family of 5, guess what? More often than not, because she does not have a support system, she does not have family members, she does not have members from her house of worship that is going to take her in, she end up going back. Finances, age, hidden illnesses, right? There are so many different reasons why survivors and victims cannot leave. There are barriers that prevent them from leaving. And I think that's one of the greatest misconceptions out here when people think about, oh, you should just leave. It is not that simple. Leaving is just as complex, complicated, and convoluted as domestic violence itself.
Mm, mm. So true. Thank you so much, Doreen and Dr. Abernathy, for adding that piece. And what you said, Doreen, too, about the support system without judgment is so crucial. Dr. Abernathy, just being able to have a safe space where you can be brave in that space is what we took away with that too, along with some of the other acknowledgments that were provided. I want to get to a couple of these other questions in our Q&A and then another one as well. But for you, this question comes in, and I will start with Dr. Abernathy. A lot of times the women are really closed off and unwilling to open up and have conversations about IPV as they're experiencing it, or DV. How would you suggest approaching them? Like, how could we start that dialogue?
Well, one, I think it's important to make sure that the conversation is in a place that she feels safe. We may think that, our office or even the counseling services that a faith community may offer, we may think that that's safe. A lot of times I see faith communities do this in error, and I've seen other clinicians too. Couples counseling is contraindicated for abusive relationships, not just romantic, but also family relationships. If there's active abuse of any kind going on, because the person who is experiencing abuse is going to come thinking that you might help, and you've assured them, and they're going to speak the truth, but they're going to be punished for speaking the truth later. The person that's there is really doing whatever they can. The person who is abusive is doing what they can to really, what I call, protect their representative. So one of the things you want to do is to start by reflecting the feelings that you hear her express. You sound afraid. Well, anyone in your situation would feel afraid. Validating that, normalizing that, helping her to identify her own emotional experience. Because when you're in an abusive relationship, you become very adept at identifying very quickly what emotional state the other person is in. And sometimes you have to do it even before they really realize it, to keep yourself and your children safe. So whenever she's talking, reflecting back her feelings, because that's the first part, because she has to come to the place where she can survey the land and know what's going to be helpful for her. And so in building that, reflecting that, helping her see, and also within a normal relationship, don't make your interactions around her always about that. If it's there and she tells you, because here's the problem, someone has violated her boundaries. And then we as helpers further violate her boundaries, right? It's her story to tell, it's her time, and she could build that support within her own environment, maybe with her neighbors, giving them signals for, when her partner is there or when things are escalating. There are ways to, and we always encourage women to get a safety plan and have that plan before you you go, as Doreen said, thinking through different pieces of it. And I think helping her to address her soul. When you're wounded in this way, this is an assault on your soul, your mind, your will, and your emotions. So anywhere you can help her, and I'm not just saying going to get a mani-pedi, I'm talking about soul care, being able to slow her mind down. You're saying, oh, you should pray, you should meditate. Okay, well, these are health issues that have been created because if a person had a cold or cancer, you wouldn't think they were weak or lazy or didn't have enough faith or didn't want to be healed. You would support them in finding the resources that would target the areas of the illness. And that's what this is. It's an interpersonal illness.
Thank you. Thank you for acknowledging that part of it too, because it's not always looked at as an illness. As you said, oftentimes it is looked at as a choice that one makes, and it's not. And I wanted to just offer up before we get to the next question. Doreen, did you have anything additional you wanted to add about how you, for women who may be experiencing this, or persons who may be experiencing IPV, particularly in this maternal mental health space that they might be in, or it's impacting, and they're unwilling to open up, how to approach them?
I would say very gently, very compassionately, empathize with them. They're not looking for sympathy. They're not looking for pity. They're not looking for any of that. Just be gentle with them, empathize with them. If they come to you and they disclose to you, if you feel that it's too much for you, um, find somebody that you can refer them to. Don't make them the subject of gossip. Um, don't minimize what they're saying to you. Don't maximize it by overreacting to something they may say to you. Because one thing that holds true with everybody who's dealing with IPV, domestic violence, when they go to a person and they start disclosing to them, that is because that is that one person that they feel safe enough to confide in, right? So we all have our social circles. Some people have 50, some people have 500. But when you're looking at a person who's being abused within their social circle, they're sitting back because not only can they tell the abuser's attitude, his personality, what's going on with him, but they can sit back and they could watch everybody and they could tell who that safe person is for them to disclose in. And when they come to you, whether they came one time, they came 10 times, they came 15 times, when you start to feel overwhelmed, they are not trying to overwhelm you. They have just found that safe space, that safe person, and that one person they can trust, right? And if you can't be that person, that's okay. But if you can be that person, please maintain their confidentiality. And when you decide that you can help them, elicit information from them as to how you may be able to help. Because once you start telling them what to do, how to do it, when to do it, and what you better do, you've become their secondary batterer. You're now trying to control everything they do, everything else. So they're moving from one battering abusive situation into another. When they come to you for help, many of them will tell you, I don't know what I want, because they don't, because every decision has been made for them. And so they're confused and they don't know how to make decisions because at that time, freshly leaving, their mind is still thinking, if I do this, what is he going to do? If I say this, am I going to get a beat down? So they are confused. But when they come to you, listen, hear them out. And just by what they're saying will also help you understand how you can or cannot help them. And one of the greatest way you can help them really is just by listening. They know that you can't really pull them out and set them up and all of that. But when you listen, you will be surprised how much power you've given them in that moment because somebody finally listened without judging.
Listening without judgment. That is a phrase we continue to hear. And I think that even as you all were sharing about the importance of prevention, I asked Doreen to re-share with me the quote that she stated, which just to reiterate, an ounce of prevention is worth a pound of cure. And so it is really to encourage us to be intentional, like Dr. Abernathy shared some of the ways we can identify, right? And we're not asking you, especially if that is not your if that is not your profession, to act in a clinical capacity trying to assess someone. We're asking just to be aware, right? I think so oftentimes we talk right now in this day and age about, minding our business and sipping our tea, as we say. But as we're over there turning the other cheek, and not in the biblical sense, we are ignoring. And from a faith-based perspective, we are called to be supportive, to not judge. That is not our assignment. Another question that I just wanted to lift up that came in our Q&A, and Dr. Abernathy, we'll start back with you again, if you could address, how do communities of faith address IPV within clergy homes?
Oh, wow. I get a lot of private messages from women who are married to men in leadership in the church. And it's very delicate. I think that one, we have to believe her, or her children, because a lot of times people say, I cannot believe that. I cannot see that. No, not him, right? You need to hold that. We can make a judgment, but once you do that, you've already kind of put yourself in the place of a judge. But I think it's important to one, to know that it exists in the clergy home. And I have some ideas just like how the faith communities can do this over time. But I think in the clergy home, it's important for the women and children to have safe places to go and for people to believe them. And because of that, a lot of times it's easier for them to go outside of their community to do that, because the people outside their community, they know that there's a man behind the curtain. I just put it like that. And so in the world of narcissistic abuse recovery, which is my area of expertise, we talk about flying monkeys. These are the people that, when Dorothy and her friends were getting away from the witch, the flying monkeys picked them up and brought them to the witch. Well, a lot of well-meaning people, sometimes they're well-meaning, sometimes they're not, they will be used to abuse you through that person, right? The abusive person can abuse you through this well-meaning person. They may bring them up after you've left. They may, if you say something, oh, she's trying to tear down that good man. And, people can be this and that, right? He can be pastor and be abusive in his home. Now, I love one of my colleagues, Dr. Anita Phillips. She says that someone can't be abusive and be a person of faith. They can't be a believer. And I think there's a big discrepancy in that, because what I found is that most men who are abusing their wives hate themselves. So there has to be a place for the faith community to deal with the hate that he has, even before he grows up to marry, to constantly know that it's there and to address it. And there are texts that lend themselves to more abusive situation. In seminary, we learned about Texts of Terror by Phyllis Tribble, Trible. And I really encourage people to be careful with those texts where women were dismembered or sexually assaulted and no justice was brought to them. And we preach them, but we don't preach it from the side of the woman. So we have to be very careful and qualify some of those texts. And that way you create an environment that from the beginning says it is not okay to misuse anyone. Anytime you misuse anyone, that's abuse. And so that creates the automatics, right? Those values that will come against this behavior once it's displayed.
Thank you for that. Excuse me. And I know that we have to make sure that we get in some conversation about what's coming up and other resources that are available. There was a question that was dropped in the chat that I just want to make sure that we can get to as well. And I'm going to position this one to Doreen. What has to happen for a victim to finally reach out and receive support and leave the violence? And I know you've talked a little bit about this, but just also helping to understand what is going on in their mind that kind of motivates them to leave finally and get away after years. So what what motivates them to leave finally, and what has to happen for them to reach out for support, Doreen?
So to the first question is like, because each situation is unique, right? Everybody's situation is unique. Everyone's battle is unique. You do have those that are well kept on the outside, they're the perfect person in the public. And you have some of them, they're messy in the house and they're messy in the street. So it depends on who that person's particular perpetrator really is, as to when a person may think that it's time to go, right? Or it just might be that one instance that is like, that's just it, right? For example, I was speaking somewhere several months ago and somebody asked me what was my aha moment. I said, well, I never thought about it like that. Me escaping in that moment really wasn't an aha moment for me. What happened on March 27th, 1998 is that as I was coming home and he was standing in front of the building, I was counting in my head, oh, I just got to get up those 3 steps. And if I could get up the 3 steps of that building to get inside the house, I would be safe. I made it up the first 2 steps with my youngest daughter, and he grabbed me and he's strangling me. She ran upstairs. A whole lot of other things ensued after that. But what happened is that when I finally got upstairs, my son came downstairs and all kinds of ruckus proceeded. He up leaving. And I got upstairs and I was looking for my then 6-year-old daughter, looking all over this 3-bedroom apartment. I found her in the kitchen under the table, crying. And as I try to coax her out, like I'm still holding my neck because my neck was cut. He had cut my neck in the process of trying to strangle me. When cops was called or whatever. And her response, I guess that was my aha moment. That was the light switch for me. Her response was, if I was never born, he would not be beating you. So the 6-year-old assumed all of the responsibility of what was happening to me over the course of her young fragile 6 years of life. And for me, that was kind of like, that was it. But the irony to that is that I did move. I moved 4 zip codes over and he found me. His dad was working in law enforcement 20 something years ago. Things were totally different than what they were, even though ironically, with the internet, they could still find you, right? And your family members and everything. But for me, that was my moment. So each person have their own um, moment where it's like, this is it, right? Like I said, I had said that, but then this moment it became like, now I really have to get extreme with what I need to do so that there's absolutely no contact ever again. And that was the last time I was ever physically assaulted by him. And I think what was my saving grace was that I had already self isolated from everyone already. So after that incident, about 2, 3 weeks later, I moved. And when I moved, I didn't tell anyone in my life where I was moving at all. So nobody knew where I moved at. I had just started working for the New York City Department of Ed back then. Um, I transferred to another school, into another borough, by utilizing the fact that my daughter was asthmatic, so I couldn't be this many boroughs away from her. So I was covering all of my tracks. So that's how I got away. So for 2 years, no one knew where I was. No one in the neighborhood knew me. They just knew me as the angry lady with 4 kids. I would go in and out the neighborhood, like different ways, come in different times. So I literally had to totally change how I was living. It's different for for so many different people. I've worked with people who have jumped out of windows, like second floor windows, and hidden under cars, right? And wait until the dark come to crawl across roads to the neighbor's house to get away. It's that extreme. It is that extreme where people take extreme measures. And then you have people who could just wake up one day and look at the person and be like, I'm gone, I'm done. But against the severity of their abuse is different than those who take extreme measures, such as myself and some of my clients who jumped out of windows and moved from New York to California. It's really different. So there's no one way that a person just decides that now is the time. It depends on their batterer and it depends on their circumstances.
Thank you. Thank you so much for that. I want to make sure that we can get it back to Dr. Q as well, Director Q, to be able to bring in a little more feedback from another speaker that we have. So in about 30 seconds, if you will, and I say that loosely because I know there's more, but this gives us an opportunity to continue this conversation, starting with you, Doreen. Could you please share maybe a recommendation that you have for the faith-based communities? And I know some have come through your conversations, but if you could give them a quick takeaway that they can jot down and go and do right now, right? So we like to be able to be actionable in these steps. But what's a recommendation for faith-based communities to help intervene, prevent, to intervene or provide some preventive measures in this space for individuals?
So I'll say it again. An ounce of prevention is worth a pound of cure. Women's ministry, bring up the topic of intimate partner violence and how it's impacting the sisters within the house of worship. The youth groups, we don't want our youth dating. We don't want them sexually involved. We don't want them involved in abusive relationships. During the youth group, bring it up, right? Preach it from the pulpit, right? This scripture inside the Bible, right? That totally contradicts domestic violence. One clear and simple is because we know domestic violence also is part of family violence, right? So it's as far as do not provoke your children to anger. Husband, your wives are a weaker vessel. So we know that there is scripture within the Bible that talks against, that preach against, that teach against this type of violence. It needs to be on the pulpit. It needs to be a Sunday sermon. It needs to be a Friday sermon. It needs to be Bible study. It needs to be in the women's ministry. It needs to be in the youth ministry. It needs to be in the ministry. It needs to be at those health fairs that the churches are conducting. It needs to be at the chicken fry-outs the churches are having. We need to get it out because the people who are inside of our pews are screaming silently and living domestic violence. Whether they are on the pulpit or on the pews, it is impacting their lives. And so we need to bring it inside the church. We need to bring it inside the mosque. We need to bring it inside the temples. We need to bring it inside. And then we need to talk about it because it impacts the person's spiritually. People come to church and are spiritually dead because they are going back home being abused.
Right.
We
And
need to talk about it.
we need to talk about it. No, you have people suffering in silence. And I know in Hebrews, it talks about husbands love your wives as Christ loved the church. And no matter what your denomination may be or how you show up, all of what we read, whether it's a Bible or the Quran, it talks about how we treat one another above all.
May I add to that? At the very core of us, outside of our faith, we are humans.
Yeah.
We are humans, and people who are dealing with domestic violence are suffering immensely, and not just physically. They're suffering holistically as a whole person. So our faith, yes, we need to include the faith aspect to it.
Yes, thank you for that. What I'm going to do, and so that we can circle back around to this conversation, to this particular point of it, Dr. Abernathy, I just want to hand it back to Director Q to introduce one of our other speakers, and then we'll start to begin our share out to close.
Thank you so much. This conversation has been so rich, so impactful. We have seen the comments in the chats. Thank you so much, everyone, for sharing being vulnerable. Doreen and Dr. Abernathy, for your wisdom around this important topic. Now I'm really pleased to introduce the Assistant Secretary for the Administration of Children and Families, January Cocheres. Let's welcome her.
Thank you, Dr. English. I'm really glad to be here with you today and for this important gathering. And I also want to thank the previous speakers. I didn't get to hear a lot, but I did hear some of Doreen's comments, and I want to thank her for her voice and being willing to use that to educate and to help us all do a better job in terms of how we support survivors. So I'm January Contreras. I have the great blessing to serve as the Assistant Secretary for the Administration for Children and Families. We serve children and families in areas that are very diverse, ranging from child welfare to refugee resettlement to Head Start, and we have a central role in preventing and responding to family violence. I really appreciate the call today, the gathering to discuss how can we as partners come together to reduce and prevent domestic violence and intimate partner violence in all of its forms, especially through community and faith engagement. There's no question that faith and community leaders have a key role in supporting people when they're having their most difficult moments. I know for so many of us, whether it's a health issue, whether it's losing someone we love, whether it's struggles of any kind, it's oftentimes our faith-based centers, whatever they are, whatever they look like, that we turn to for strength and for wisdom and for the ability to get through one moment to the next. So, when you're talking about family violence, domestic violence, intimate partner violence, I especially appreciate how you're discussing that with maternal health, because those are two things that happen in people's lives where they're tough. Being pregnant, being a new parent is tough, as beautiful as it is. And having violence enter your life during that time when you're especially vulnerable, when you're at risk, is it's a very serious situation. And I think taking it on today is very important. Through faith and community leaders, I know we can increase the awareness of the reality of violence in homes. And when we do that, we empower local leaders with the trust and the authority that they already have to speak into the challenges of life within a home. We make it safe for survivors experiencing this violence to let their community leaders, to let their faith leaders know that they're hurting and they need support. Prior to coming to this role, I led a legal aid organization for the last 8 years and represented many, mostly young women, a lot of young parents, a lot of women of color who were in this situation. And so many things that made them more vulnerable. Whether they had an infant and they couldn't afford childcare, they couldn't get a job on their own because they couldn't afford childcare. The stressors that exist, but the risk that exists also of feeling like you have nowhere to go, are such big parts of the reality for so many young people experiencing violence in their lives. When survivors say they're experiencing violence, it's important for us, all of us as community leaders, to know, how do we help? How do we help? And as faith and community leaders, knowing where your local programs are that support, knowing what your role can be on a one-on-one support for your community, but also all those resources that are available in your area that can help someone get from an unsafe, harmful situation to one that does keep them and their children, if they have them, safe. We want to keep survivors safe, and you are an important part of that. When we're working to identify who our local partners are, we'd love to help you have access to knowing, what are the resources there that are within reach for all of the people that you serve. How do we make sure that you have those resources at your hand in a crisis moment, so that you can deal with helping someone one-on-one, and we have the resources there already for you to access. Here at ACF, we have the Family Violence Prevention Program. This came out of a federal law with bipartisan support. And I see, actually, I saw earlier our fearless leader of the FIPSA program on the phone today, Shondell Dawson. So I want to lift her up. We're very grateful for her leadership here at ACF. Overall, after 38 years of federal leadership and support for community-based services to meet the needs of domestic violence survivors, FIPSA services, that's the Family Violence Prevention and Services Act services, and the hotline remain in great need. FIPSA supports community-driven solutions. We are addressing domestic violence. We're promoting partnerships, whether that's with community-based agencies, local health care centers, and others, so that when someone enters a place for help, whether that's a faith-based community, whether that's a domestic violence shelter, whether that's a hospital or a family advocacy center, we want them to be able to, when they walk through that door, to enter the gateway of services and resources that are available, especially through ACF, but that are available elsewhere through other resources as well. In 2021, we funded over 1,600 programs through FIPSA that served 1.2 million survivors. Our hotlines responded to almost 3 million crisis calls. I will share that last week I was in Austin. I visited the national hotline, domestic violence hotline with Shondell Dawson. And it was tough to listen to the calls, to listen to the desperation that people experience when they're fearing for themselves, they're fearing for their children. And so, all the work that we support, we feel privileged to do so, because more often than not, it's those partnerships at the local community that are making the biggest difference. Partnerships between faith leaders, between domestic violence providers, between healthcare providers, they're all critical to providing comprehensive support to families and individuals experiencing intimate partner violence. We know that when people need help and safety, they're often going to turn to who they trust. And so we want to arm you with all the resources that we have. And we want to learn from you too. What do you see that's missing? What have you noticed? What have been questions that have been harder to answer? We know that the need remains great, that advocates are working diligently and thoughtfully to be very responsive to diverse, to multicultural, to multilingual communities. That's very important. And still, we know this work can be made even more impactful if we continue to enlist the support of our community partners. And that includes everyone on this call today. Your leadership and your expertise will foster innovation that can help us continue to increase how we're meeting the needs of survivors. Our vision here at ACF is that every community has an integrated and trauma-informed system of care. We want to leverage the resources and knowledge of leaders like yourselves who help us bring that vision to life. I have, again, having served domestic violence survivors personally, it's a moment where sometimes they don't know if they're going to make it. You can hear it. And I know many of you have experienced this yourself, and speaking to those, maybe someone you know or love, or someone you've worked with, or we've seen it in our own homes. But not knowing what tomorrow's going to bring, not knowing if you can keep yourself or your children safe, it's just such a part of someone's reality that we can help make a difference in. We can literally help make the difference by putting options and resources in front of them that they can be a part of. And so, earlier I mentioned the importance of connecting to services. One place we want you to know before we end this, in my remarks anyway, on this call, is to share the National Domestic Violence Hotline, which is funded by the Administration for Children and Families. That National Domestic Violence Hotline, which is 1-800-799-7233, that provides an immediate response to victims of domestic violence and their families. And it has a seamless referral system to community programs that are right there in the local community where the caller or the texter is. So I watched calls and I watched texts, both, while I was at the National Domestic Hotline last week. They try to provide different avenues of communication for whatever works for different survivors. That hotline is operated 24/7. It's available in 170 languages. It's the first step to safety for many callers. And with a local referral to assist the caller in dealing with some of the long-term effects of family violence. So we hope you will keep that resource handy. We hope you don't need it often, but we do know that you're someone that you and your colleagues and others in this community are people who those in need will turn to. So we want you to have that resources and others that have been shared through this call today. So again, I want to thank Dr. English for inviting me and ACF to be a part of the call today. I want to thank the other speakers and Doreen for all that you've shared today. I just feel very privileged and lucky to be leading an organization that impacts lives in so many ways. But we only do that better when we learn from you, when we're listening. And I hope I have the opportunity to work with many of you in different ways as we move forward. Thank you very much for your leadership and all you do for kids and families in your own communities.
Thank you so much for just the wealth of information, for your continued efforts, and for continuing to help create this space. I said at the very beginning that sometimes you'll do this work at the community level and grassroots, and you're not sure if it's making a difference or if you make a difference, but to have you show up in this space January. Earlier, we had Melissa on, and it's just been such a privilege to know that our leadership is being seen all throughout. So as the Assistant Secretary, we just appreciate you, we honor you, and continue to be here to support you as well in these efforts.
Thank you so much.
Thank you for that. For those of you, we appreciate you for continuing to stay with us throughout this experience. We are just going to do a share out. We don't want to just close this space out and not realize that someone could have been impacted. And along this time that you've been with us, if you need any of these additional resources and you didn't get a chance to catch or copy everything in the chat, you can save the chat by clicking on the 3 dots open where you would type, and you can just click Save Chat. We will also be, or I should say, a follow-up email may be coming that'll include ways for you to participate. As part of our final share out, we just want to lift up the words that we've heard. So we're going to drop a link in the chat to participate in our what we call our Menti poll. And I'm going to share screen here so that you can either click the link and there's a participant code that comes with it. Thank you so much for dropping that. And then also, if you prefer, if you have your phone available, you can just click on this QR code that will be shown, and you can scan that as well to be able to see. We'll give a few moments for those to be able to join in. What we would like you to do as you open up this Menti poll is just drop a word in there that helps us to talk about what was released in this space, right? So we're here to promote unity. We are here to promote encouragement. So drop a word of encouragement for someone or for yourself, or a word of power for someone or for yourself. Again, you can use the link that was dropped in the chat, or you can scan as well to see the particular code. And then we will continue to show often this. Let's see. Oh, apologies. I think I'm sharing the wrong piece, but I'll share the Menti code again, the screen, excuse me. So here is the QR code that you can scan, and you can either use the link in the chat, or you can use this QR code to scan with your phone and use that code and just start to drop words in there that will help to encourage someone, or that will help to provide a word of power. And I'm going to share with you so you can see what words are coming up in this space as well. So you get the visual of what has already been shared. So we see strength, we see empowering, we see understanding and healing, love, voice, being acknowledged, conquers, transparency. So continue to drop those words of encouragement for someone, for yourself, as well as what we would consider a word of power. And with that, please continue to do that. I'm just going to stop sharing, but know that it is still continuing to live and breathe in this space. If you have an opportunity to, you can take a screenshot of it just to encourage yourself as well. And I'm just going to hand it back over to Reverend Dr. Q English to close us out and talk to us about some next steps.
Thank you, Alexia, and thank you to our panelists. Thank you to the staff that helped pull this together. This has been so rich and so impactful. And hopefully you took some great notes and you find yourself right in the midst of wanting to be a part of this call to action as we think of the effects of intimate partner violence and domestic violence on maternal health. We're going to be continuing this webinar series, and we want you to follow us as we talk more and explore more about what does holistic model of care look like for expecting individuals. We want you to be involved in that conversation, and we want you to help put your hands to the plow in helping us, making sure that our mothers and our expecting individuals have a holistic model of care, and we need you to do that. Why? Because here at the federal level, we seek to see the United States become one of the safest nations for women giving birth. Thank you again for your time. Looking forward to continuing the conversation. And if you have anything that you would like to share in this space, please reach out to the Partnership Center at partnerships@hhs.gov. That's partnerships@hhs.gov. We would love to hear the work that you continue to do. Have a great day.